Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We're recording on July 15th, 2025. Welcome back. We took a couple of weeks off this month for the 4th, and I was out in the mountains, but we are back. This week, Health Affairs released its second Insider Trend Report. The first one was on artificial intelligence in healthcare. Hopefully you caught that. This new report is titled The Healthcare Workforce, a Challenge in Sustainability. It provides insights into the key factors surrounding the current and future sustainability of the healthcare workforce. You can get this report by becoming a Health Affairs Insider member, where you also get access to exclusive virtual events as well as exclusive newsletters straight to your inbox. One of the things this report touches on but doesn't dive into deeply is the current HR regulations affecting all businesses, including providers. So to discuss those regulations, I'm joined today by Ryan Golden, senior reporter at HR Dive. Ryan and I used to work together at Industry Dive. I used to steal HR Dive articles for Healthcare Dive on the Rega. It was beneficial on my end. I think it was beneficial on their end. We might not get to that, but here to talk about HR regulations, Ryan Golden, welcome to the program.
Jeff, thanks so much for having me.
Ryan, so you are based in Baltimore, is that right?
That's correct. Yeah, born and raised.
Born and raised. So we are a month and a half after the release of Never Enough by Turnstile. Is the city still talking about it? Is it over? What's the party line there?
Oh, I'm kidding. Turnstile is the talk of the town. It's amazing to see an indie band grow from where they started out, and now they're on the national stage. It's incredible. I love seeing Baltimore represented, in the media, in the popular sphere, and Turnstile is a huge highlight. Love them.
Fantastic. Yeah, I saw them at the Anthem about a couple of years ago. Fantastic show.
Absolutely.
Glad they're doing well. So moving on, from regional to more national issues. So looking at HR and recent regulations that you track while at HR Dive, can you give us a top line on what's the biggest changes to employment laws that industries such as healthcare may need to know about?
Yeah, absolutely. And I had three specific ones I wanted to highlight for your folks at Health Affairs. The first one is, of course, diversity, equity, and inclusion, otherwise known as DEI. We have seen quite a bit of rollback on DEI initiatives within the last few years, pushback on the cultural level as well as the legal level. Of course, you know that the Trump administration has been particularly insistent on cracking down on what it has called illegal DEI. It's put many of the regulatory agencies in charge of workplace law on this subject, including the Equal Employment Opportunity Commission, also known as the EEOC. They have targeted law firms based on their DEI programs and have tried to emphasize to employers that they're very much interested in cracking down on this area. And as a related note, this just happened, in the employment law sphere, the Supreme Court decision in Ames versus Ohio Department of Youth Services, which deals with so-called reverse discrimination, where majority group plaintiffs allege workplace bias. That decision, which was a unanimous decision authored by Justice Ketanji Brown Jackson, was seen as a very landmark one for the workplace. It eliminated some standards that certain courts maintained for majority group plaintiffs to allege workplace bias. And folks who I speak to think this will make it easier for those plaintiffs to bring such claims moving forward. So to the extent that healthcare employers have DEI initiatives in areas like recruiting, hiring, promotion, or even things like employee resource groups, they should be aware of these developments and just be aware of the laser focus that lawmakers and members of the public are placing on DEI. The second one is religious anti-discrimination law. So we are seeing quite a bit of claims in things like vaccination requirements. Of course, when COVID happened, we saw a lot of vaccine requirements in healthcare and other industries. Employees have filed suit saying that these requirements go against their religious beliefs, and they do have protections under federal civil rights law. So we've seen a variety of cases on this subject, and that particular area is also subject to a Supreme Court decision regarding religious accommodation requests in Groff v. DeJoy, where the court said it would lower the bar for plaintiffs to bring Title VII claims based on religious beliefs and accommodations against employers. So the rulings on religious anti-discrimination vary from court to court. They're very fact-specific. And it's hard to really extract a general trend for employers, but it's just important to note that it's out there, and there are many bases at play on those particular cases. And third, finally, you mentioned AI. I think that's important to note that In HR, we're constantly looking at developments in artificial intelligence. Executives are expected to have a perspective and a vision on AI. It's going to look different ultimately for every industry, but in healthcare, it could affect things like how physicians treat patients, and especially how administrative tasks are performed, things like scheduling, patient follow-ups, and management of employee schedules pertinent to this conversation. So expect to see continued interest in AI solutions, both inside and outside of HR, as well as healthy skepticism of AI. And in the regulatory space, we're watching a case against an HR vendor by the name of Workday in California, which is about the discriminatory impact potentially of AI in hiring specifically. So, yeah, very much an emerging area, watching that very closely.
Yeah, so that case in Workday, correct me if I'm wrong, that's kind of generally like you upload a resume, then they ask you to do it again, and they may use AI to filter you out.
Yes, the employee in that case, or the job applicant in that case, is alleging that he was screened out of multiple roles due to his age, and he's been given class certification in that case. So that could apply to far more plaintiffs than just himself. So it's an ongoing case, and I think it's maybe the most significant case we're watching as far as AI intersecting with HR right now.
Yeah, will be fascinating to watch. So thanks for that. I might want to ask you a little bit more about some of those going forward after we talk about some of the things that are touched on in the report, but not too deeply. One of those things is the changes to overtime eligibility criteria. A little bit of a will they, won't they kind of situation since 2016 or so. What's the latest on this criteria? It's a final rule, but maybe it's not?
Yeah, it's confusing. This is one of those areas that always changes hands.
It's nice to know I'm not alone. Thank you.
No, you're absolutely not alone, Jeff. It is a confusing area. It changes whenever the White House changes hands. Most recently, you had the Biden administration attempt to raise the overtime eligibility criteria for U.S. workers. They tried to do it in 3 steps. There was a July increase, a January 2025 increase, and then they even implemented an automatic increase strategy for 2027 and beyond. Of course, this was held up in the courts. Eventually, there were federal judges in Texas that struck down the rule. Currently, it's technically still in litigation, but because the Trump administration really hasn't signaled it will litigate on behalf of the Biden rule, it's pretty much dead in the water, according to the folks I speak to. So the latest update on overtime, in 2019, the first Trump administration actually increased the overtime eligibility threshold. It's now hovering around $35,000 a year. And, it depends on what duties your workers perform as well as how much they make, whether they're eligible for overtime pay. In healthcare, the rule that you need to pay attention to is the executive administrative professional designation. And, workers may or may not fall under that. There are other exemptions for first responders and other categories, but it's just one of those issues that we continue to watch change on because, especially given that this rule is still technically, up in the air in the courts, but, there's not much defense of it from the current administration. It's hard to see. And I just want to note also, you continue to see healthcare systems deal with overtime pay. Litigation, there was a lawsuit filed in June by nurse managers in Georgia versus Humana, which claimed the company didn't compensate them for overtime pay. It continues to be an issue for not just healthcare employers, but employers generally, just keeping track of hours, keeping track of exemptions, things of that nature.
Yeah. Do you foresee a future where this might be, for lack of a better term, settled, where like administrators can know what to do or how to think about this?
At the federal
or are
level,
we already here?
Yeah, I mean, at the federal level, it's settled for the time being, right? For the next 4 years, we have some sort of guarantee that it's not going to go to the levels that the Biden administration proposed. So that's a bit of ground for employers to look at. Whether we have future changes, again, it's one of those issues that just, when a Democrat is in office, they're very insistent on changing it. You have to recall, and maybe your readers are familiar with the 2016 Obama overtime rule that was blocked similarly by federal courts. Before that rule, we hadn't seen an overtime threshold increase since I think it was 2004. So this used to be an issue that lawmakers came to back pretty infrequently. Now it's a very hot button topic that successive administrations have addressed in some way, shape, or form. So definitely wouldn't be surprised to see it be addressed again before the next administration comes into power. But it's one of those things that for the time being, there's a bit of clarity going forward.
Right. Well, thanks for providing some of that clarity. Another hot button issue is pay transparency, particularly in the wake of the COVID-19 pandemic. I'm sure prospective employees love this, wanting to know what the pay range is. Some employers have given wild pay ranges like $0 to $500,000 in some job descriptions. Don't quote me or don't quote any particular job description on that. But it looks to be something taken up mostly by states currently. Have we heard about how the transparency is faring in terms of attracting or retaining talent? Like, what's the latest on that?
Yeah, that's dead on. State and local lawmakers have really taken up this issue, and it's one of those employment law topics we've been tracking for a while, where it's just we call it the patchwork, right? There are certain states and jurisdictions where they address this sort of thing, and certain states where they don't. And those areas that do address it tend to have a lot of employers, a lot of large employers. Think about places like California, New York City, Pennsylvania. All up and down the East and West Coast, and in the Midwest as well. Pay transparency, it's something that the research on it is still very new. I will say that whether or not it's a beneficial thing for reducing things like pay gaps. I've seen a lot of literature on it in both directions. I wanted to cite a few statistics. So in 2023, we got a report from SHRM, which, if you're not familiar, is HR's biggest industry trade group. They found that pay transparency had a positive effect on employers who participated in pay transparency. They saw a boost to attracting skilled applicants, and SHRM actually specifically said that 70% of the employers it surveyed that had pay transparency say that doing so led to an increase in applicants. We also had a vendor report in 2023 from PayScale, which said that pay transparency reduced turnover among employers. As far as whether it reduces pay gaps, I've found a little bit of mixed, as far as I have my own reading of it, my limited reading of the research out there. It's sort of mixed. There has been some reporting that it reduces pay gaps. In some instances, while it can also have negative effects, such as discouraging lower performing employees from asking for higher pay, and that's lower performing in terms of whether they self-perceive as lower performing compared to their coworkers or actually lower performing, it discourages them potentially from asking for higher pay when they see how their coworkers, their cohorts are paid. So the research is still very new. I would encourage people to just keep an eye on it. And I mean, whether or not what the employer's perspective on pay transparency is, it's clear that the states and local jurisdictions are very active on it. We just had a new law passed in Cleveland, so one of the biggest cities in the U.S. Midwest now addressing this topic as well.
Yeah, do you get a sense that this will kind of trickle out even more patchwork as it becomes more normalized, or is it a yet to be determined kind of thing?
Yeah, it's one of those things where federal lawmakers have tried to put forward legislation to address it. No effort has succeeded, so far. So you have this, as with many employment law topics, you'll find, there's just different approaches on a state by state basis and even on a city by city basis. So for now, it's very much that patchwork until you have a federal law that provides a little bit more clarity and security.
So much like pay transparency was buzzy coming out of COVID-19, also remote work was a big topic because it was kind of necessary in 2020 and 2021. And now you kind of see some return to work efforts. Have you seen from an HR, retention and attracting talent perspective, have you seen any trends from remote or hybrid work that have bared out any interesting results that you could share?
Yeah, I mean, this is, of course, a hot button topic. And it's hard for me to think of a specific statistic, but I will say one thing that we consistently find looking at surveys of job candidates is that they value flexibility. Flexibility continues to be something, and flexibility that can encompass, full-time remote work. It can also encompass hybrid work, part-time in office, part-time at home or somewhere else. Even like flexibility in hours, like maybe you have a schedule that you can choose a certain number of hours per week, or you can work a certain time frame in a given week compared to a different day where you work a different time frame. Those kinds of options have tremendous sway among job candidates. And of course, it's become more in vogue for employers to return to office, or RTO as we call it. You see more and more employers doing that. I would say it's fairly mainstream. We had a transition period in COVID from I'm going to say 22 to 24 where employers were in the middle in large part on this, but I think we've fully swung in the direction of RTO since then, at least for most large companies, right? And that has affected, employee relations, it's affected talent, but I think the constant drumbeat I hear from analysts and, HR folks is that, flexibility is still valued. So even if you have an RTO requirement, letting people come to the office a certain amount of days and also work from home a certain amount of days per week is still very valued, as is the things like, being able to have flexibility in scheduling and shift changes and things like that.
Yeah, and another hot topic is non-compete agreements. You see this in the healthcare provider space and in the health tech space a lot, or in the startup world as well, which includes a lot of health tech startups. There was a final rule kind of barring these non-compete agreements, but it looks like it's working its way through the courts, and non-competes are permissible in the meantime. What can you tell us about this?
Yeah, that's right. You're referring to the Federal Trade Commission (FTC) ban on non-compete agreements, with some limited exceptions. This was under the Biden administration in 2024. They allowed some exceptions for certain senior executives, and they sort of outlined what that looks like. It was a very I would say it was kind of surprising for us in the HR space to see that happen. However, it was effectively it was struck down by a federal judge months before its September 2024 deadline. So it never took effect, and it's still tied up in the courts. We're not quite sure where that rule goes from here. We have quite a bit of bipartisan. There's been some interesting, if you look out at the accounts that are available in news websites, you can see that there are politicians and there are influencers on both sides of the aisle who sort of look at non-compete bans positively, think that they're a bottleneck on competition. You also have quite a bit of consensus in the business community that these kinds of agreements are valued because they help protect things like trade secrets, customer bases. There's quite a bit of variety and perspective there compared to some of these other topics. So as far as where, let's say, the Trump administration goes on this, I think it's really yet to be seen. We haven't really seen the administration firmly say where they're going to stand on this. But what I can say is that in the meantime, right, the states have moved forward in implementing non-compete bans. So I wanted to call a few out examples that specifically affect the healthcare industry. So a law firm that we follow, Littler Mendelson, they've reported that several states have enacted these kinds of agreements specifically affecting physicians and other practitioners this year. Oregon passed a law in June which voids non-competes which involve workers with certain medical license. And in Texas, there are time and geographic-based limitations according to regulations there on non-competes for physicians. So I hate to be repetitive, but this is very much something where the states have taken the lead for the time being, while the FTC rule is sort of held up in the courts.
Is there a specific definition of the term trade secrets yet?
Yeah, I mean, I would probably defer to an attorney on that one, but
okay.
The non-compete as a concept, right? It's to protect from competition with a competitor, right? So the main thrust of that kind of agreement is it's a restrictive covenant. And the goal is to protect the customer base, to protect the business. There are other forms of restrictive covenants that employers could look to in the meantime, things like NDAs, non-solicitation agreements. There are things like garden leave, which is a arrangement where you pay someone to not work for anywhere else, or for a competitor for a certain amount of time after they leave the business. And there are some wrinkles in garden leave that you may want to consider legally looking at, depending on what regulations are in your specific little geographic area. But there are other options besides non-competes is the point. And there are many motivations to pursue non-competes, I think. But that's it. I guess the answer to the question is it varies depending on who you talk to.
So as we wrap up, are there any other major federal or state HR rules that you feel our listeners should know about?
Yeah, absolutely. I just wanted to call out again the artificial intelligence and the hiring process part of it. I think it's relatively new. We do have a handful of states. We have a tracker on this on our website. We have a few states and cities that have implemented laws that specifically regulate AI in hiring. The most notable ones are probably New York City and Colorado. Colorado's is fairly extensive. There are requirements around notifying applicants about using AI, disclosing what the AI is used for, what it does. And there are even certifications. So there are requirements. I think New York City has a requirement that you have to actually recertify the system with the city government. And I would check my tracker on that just to be sure. But it's something that's emerging. And we're actually watching in California. They are developing regulations around this, and I believe a few pieces of legislation around AI and hiring. California, just for those who aren't aware, is sort of seen as a bellwether for employment law. So if California passes something, it's very likely that other states will move forward and do something similar. And given that California is where many of these AI companies are based, it's double impactful because it directly impacts some of the biggest players in the AI space in general. So that's something to keep in mind.
Yeah, and that website is HRDive.com. Ryan Golden from HR Dive. Thanks again for joining us today on Health Affairs This Week. Is there anything, just as we wrap up one final time, that you want to promote while you're here?
Yeah, and thanks so much for the opportunity, Jeff. If you have an HR professional at your practice or organization who's struggling to keep up with all this, hey, we get it. We've got them covered at HR Dive. Our content is free to readers. We don't have paywalls. We cover news, general tricks. We've got daily and weekly newsletters. So the daily issues, they cover general news and talent-specific trends, so recruiting, that kind of thing. The weekly issues cover compliance, training, D&I, and compensation and benefits. So I highly recommend the weekly newsletters for those who want snapshots of specific topics. The daily ones are more of a broad-based overview. And I also wanted to highlight in October 8th, we have a free live virtual event coming up at HR Dive on open enrollment planning. So open enrollment interfaces with healthcare quite a bit. If you manage employees or manage employee benefits plans, or you interact with employers, health plans that may interest some of your listeners. And one of our reporters, actually, Ginger Chris, she'll be hosting a panel at that event on the unsustainable healthcare cost increases we've been seeing in the U.S. I know that's a hot topic, and she'll be specifically talking about what strategies employers are using to address that. So that may be of interest. Yeah, and Jeff, you called out the website, HRDive.com. We're also on social media, X, Facebook, and most prominently on LinkedIn, where we not only do we post our stories, we also have a discussion group for HR professionals who are interested in talking about professional issues, different trends they're seeing. We see a lot of different variety from our folks on LinkedIn.
Well, great. Thanks for sharing that information. We'll post links to HR Dive and hopefully the event in the show notes for this episode. Ryan Golden, thanks again for joining me today on Health Affairs This Week. And to you, the listener, if you enjoyed this episode, please send it to the recruiter in your life. Thanks again, and we'll see you next week.